Hi, my name is Carson Hartlage, and I'm a third year MD PhD student at the University of Cincinnati. I'm also a 2024 Capello Fellow embedded in the Access to Affordable Care Impact area. I'm honored to share my journey and passion in health advocacy with you today. Let me start by giving you a little background about myself and why I got into advocacy. I'm a member of the trans community, which has been historically excluded from medicine and continues to face barriers to accessing healthcare. This has significantly shaped my perspectives on healthcare and social justice. Additionally, throughout my educational journey, I have been fortunate to receive opportunities that many do not. This privilege drives me to pay it forward and use my position to fight for equitable healthcare for all. Some of my favorite health advocacy experiences have been at the city level. Last year, some fellow medical students and I advocated for medical debt relief in our city. We testified at a public hearing and authored an op-ed in a local outlet. This led to our mayor allocating $1.5 million toward medical debt relief, which impacted over 50,000 residents of our city. At the state level, Ohio faced an important election in the fall on a constitutional amendment that would protect the right to abortion. To support this movement, I worked with some other students to write and organize an open letter campaign supporting the constitutional amendment that was signed by over 500 students from across the state. We engaged with media at the Ohio Capitol Journal to get our message out. Another important issue in my state has been gender affirming care. House Bill 68 is a bill that bans gender affirming care for minors. In the fight against this bill, I drove up to Columbus and testified at a public hearing of the Ohio Senate's Government Oversight Committee. I also contacted my state legislators ahead of votes and sent action alerts to my network. Although this bill ultimately passed and is currently held up in court, I've continued my advocacy for the trans community. I currently serve on the board of directors of Trans Ohio, the first and largest trans-led statewide organization in Ohio. My efforts with Trans Ohio have included media engagement, submitting public comments on administrative rules, and providing direct aid to patients and families affected by anti-trans legislation. I had my first opportunity to engage in direct federal advocacy just a couple months ago. In collaboration with physicians from Physicians for a National Health Program, I met with my US Senator Greg Landsman to talk about the dangers of Medicare Advantage. I used the power of storytelling by sharing a story of another med student's grandfather who was negatively impacted by a Medicare Advantage plan. I recently started a new initiative with Doctors for America under the GREED subcommittee. I'm working with physicians and other students to put together a monthly newsletter called the Egregious Newsletter that will include perspectives, data, and stories. Our goal is to change the healthcare narrative and tell about how deeply embedded greed is as the primary driver of just about every problem in American healthcare. We hope to change the conversation about American healthcare. It's hard to capture all that I learned in the Capello Fellowship in one presentation, but I think an important lesson I've learned is the importance of relationship building, not only in specific aspects of advocacy efforts, but in value of all the connections and networks that I've built through being a member of DFA and the Capello Fellowship. I will carry these lessons forward in my future advocacy efforts. I'm dedicated to continuing this work to make a positive impact on our healthcare system, driven by a deep commitment to justice and equity. Thank you for allowing me to share my story. Thank you to DFA for allowing me to be a member of the Capello Fellowship, and I look forward to continuing this important work with all of you.